Welcome back to the Popkin Method, where real medicine meets real results. Today, we're diving into a topic that's exploding in popularity: regenerative medicine using peptides, hormone replacement therapy, and more advanced stem cells and exosome therapy. In this episode, Dr. Popkin breaks down how these therapies work, who they're for, and how he blends them into a truly personalized, physician-led plan. Let's start at the top, Dr. Popkin. Why are regenerative therapies like peptides, hormone replacement therapies, stem cells, and exosomes, say that 5 times fast, suddenly everywhere? Everyone's talking about it. What is driving all of this hype?
Well, I believe the need for people to close the gaps in traditional healthcare is really driving the hype for regenerative therapies. And there's a huge demand for higher level care that is just not available in the primary care setting. For example, most primary care doctors, they don't address obesity, hormone-related issues, sexual function, chronic fatigue, pain, or sleep issues. That's why you're seeing these specialty clinics pop up everywhere, treating things like erectile dysfunction, hormone replacement therapy, hair restoration, weight loss with the GLP-1 medication, semaglutide and tirzepatide, other anti-aging services, and most recently, these peptide clinics. So there's a huge need for these services, but unfortunately, people have to step outside the primary care setting and go underground, so to speak, to various online or local clinics to get these services. And it's often done without regard for the patient's underlying medical issues and certainly not supported by any type of comprehensive care plan.
All right. So what is your honest take on why these therapies are being marketed right now, especially online and in some wellness clinics?
Well, the marketing is clearly geared towards people's desire to feel like they did when they were younger. And there's nothing wrong with wanting to feel younger, but unfortunately, these treatments individually don't solve the problem unless they're supported by a comprehensive program that incorporates all the different elements of internal medicine and functional medicine, which again, most of these clinics and online services, they just don't offer. So for instance, all of my functional medicine programs are deeply rooted in internal medicine. With my training at the Cleveland Clinic Foundation, and they follow the same basic structure. And my method starts with lifestyle modification, diet, exercise, and proper supplements, which tend to improve most of what patients have issues with. After that, I incorporate peptide therapy and hormone modulation to further improve the patient's condition. And then beyond that, I look towards other exotic type treatments using stem cells and exosomes to improve more treatment-resistant issues. And finally, help manage prescription medications to round out the patient's care plan. And I really do everything I can to try to decrease their reliance on prescription meds.
It sounds like people are wanting like just a magic pill or a magic bullet, an answer for this, but it really is a very comprehensive, holistic treatment that they need in order to solve some of these problems, as I'm understanding from what you're saying.
Absolutely. Yeah. And it's something that, whereas it would be nice if we had that magic bullet, but anything that we use to incorporate into someone's care plan really has to be supported with all the different modalities. And as I mentioned, lifestyle modification, diet, exercise, and some basic supplements really help most of what people are complaining about. But after that, then we go into things like peptides and hormone replacement therapy, and then stem cells and exosomes.
Yeah, we don't realize that our lifestyle is a major cause of why we have a lot of these issues. That's so interesting. But you keep mentioning the word peptide. Tell us what exactly are peptides? How do they work in the body? And perhaps what types of peptides do you actually use in your practice and see success with?
Sure. So yeah, peptides, they're all the rage right now. And simply put, peptides are short chains of amino acids, which are the fundamental building blocks of proteins in our body. And they act as signaling mechanisms and signaling molecules in the body that help to regulate most of the functions in our body, like metabolism, hormone production, and cellular repair. Our bodies naturally make peptides, and like everything else, the older we get, the less peptides we make, and the ones that we do make, they're typically less effective. So by supplementing with naturally occurring peptides, we can improve patients' health in a number of ways. So I'll give you some examples. Right now, again, all the rage are the GLP-1 weight loss medications. So I use the GLP-1, GIP, and glucagon receptor agonists, or an agonist is a lookalike, for lack of a better term. And we use these for weight loss. And we're seeing this with semaglutide and tirzepatide, and the new retatrutide, the triple G agonist that just completed phase 3 trials. These are all the rage right now for weight loss. I also use growth hormone stimulating peptides like sermorelin, ipamorelin, tesamorelin, and CJC1295 to help patients stimulate their own production of growth hormone. Then I also use BPC157 and TB500, which is known as the Wolverine stack. And typically I use this for tissue repair and wound healing, post-surgical healing as well. And both of these peptides are naturally produced in the body in response to injury. So again, these are naturally occurring compounds in our body that we make. We just don't make enough of them, and we don't make them of enough quality as we age. And then other peptides. I mean, everyone's heard of insulin. Insulin is a peptide, so we've all heard about that. So you see, peptides are naturally occurring signaling molecules that, if properly used, can really help benefit patients for a multitude of issues. So some of the main peptides, I've listed some of them, but typically the ones I use in my practice, I'm trying to treat key functions and medical conditions that patients are having issues with. So as I mentioned, BPC157 and TB500, they're used for cellular signaling, and that's the Wolverine stack that I mentioned that treats patients that have injuries and wounds and post-surgical healing. I use the GLP medications, as I mentioned, semaglutide and tirzepatide for weight loss. And they mimic the hormones that our own body makes that influence appetite and food transit throughout the body. Again, I mentioned sermorelin, ipamorelin, tesamorelin, and CJC1295, which again are our hormone mimics that our body makes on a regular basis. And that stimulates growth hormone in our body. Growth hormone does a multitude of things. It helps with anti-aging, and it helps with skin, hair, content. It'll help with muscle repair. It helps with better sleep, more energy. So there's really a lot of good things that growth hormone does. So as we get older, we don't make enough growth hormone, so we can use these compounds to stimulate our own production of growth hormone. I use a lot of GHK copper and BPC157 for skincare. And these peptides, when combined together, will boost collagen and elastin formation. It helps to reduce wrinkles, improve skin texture. Some other peptides that I use, AOD9604 and MOTS-C, I'll combine them with the GLP-1 peptides for patients who are on trying to lose weight. And in particular, I'll add those two for patients who plateau on the GLP-1 medications. Specifically, AOD9604 helps you to burn more fat, and the MOTS-C will increase energy production. So those are all good things when you're trying to lose weight. And lastly, I use a lot of C-Max for brain fog, C-Lang for anxiety. Super exciting peptide is BDNF, or brain-derived neurotrophic factor, which I'll use for neuroinflammatory diseases like Alzheimer's disease, Parkinson's, Huntington's disease. So these are all really promising peptides that are geared towards helping with the symptoms. They don't get rid of the disease, but they help with the symptoms that the disease causes. And I'll even use those in some systemic autoimmune issues that people have, rheumatoid arthritis, inflammatory bowel disease, just because they work really well in helping to decrease inflammation. They promote neuron survival. They modulate the immune response. So really, again, the peptides, they're used for improving the outcomes. They don't cure the disease, but they help to control the symptoms. So as you can see, the proper use of peptides is quite nuanced, and it really should only be trusted to a provider that has the knowledge and experience in how to use them, and use them in conjunction with good internal medicine and functional medicine principles.
Yeah, cellular health and making sure that our body's functioning the right way with all of these things that we're not even creating anymore, and also not even getting the proper nutrients from the foods that we eat that aren't as nutritious as they used to be. And then all the stress and all the lifestyle, compromisation that's going on. It really is a recipe for disaster, but so lovely to hear that there is a solution to replace and replenish kind of what we naturally deplete in these crazy lives of ours that we're living now. Something else that you mentioned too is hormones. And hormone replacement therapy has also exploded online telemedicine platforms to brick and mortar clinics. We're seeing everything about peptides and hormones, but we're prescribing these to both men and women now to treat everything from ED, PE, fatigue, brain fog, weight gain. You mentioned all of those different things. So where does it actually make sense and where is it overused? Do hormones have like a vertical that they just kind of knock out of the park, or are they kind of one size fits all with everything?
Well, this is a great question because hormone replacement therapy, it makes sense when you think of it more like hormone modulation or hormone manipulation, because not everyone requires hormone replacement therapy and not everyone needs treatment at all, in fact. So as I mentioned earlier, lifestyle modification, diet, exercise, and supplements will fix most of the symptoms that patients are complaining of. You'll hear this as a common theme throughout the podcast. Then we look into peptides and hormone modulation to close that gap in care. Then I use stem cells and exosomes for more treatment-resistant conditions. So as I was talking about earlier, the concept of hormone replacement therapy or hormone modulation is we want to see if we can increase the patient's natural production of hormones like testosterone and estrogen using hormone modulation and supplements versus actual hormone replacement therapy where we inject testosterone into men, or we use estrogen, progesterone, and testosterone creams in women. And I think to understand this, I have to explain a little bit about how our hormone system works. You see, hormone production is controlled by a negative feedback loop or multiple negative feedback loops that are controlled by something called the hypothalamic pituitary target axis. So I'll explain. I'm not going to get too into the details here. But the cycle really starts in the hypothalamus of your brain that senses the hormone levels in your body. And if they're low, it'll send a chemical signal to the pituitary gland, which is at the base of your brain. And then that pituitary gland will then send a signal to the target organ. In the case of hormone replacement in men, that's the testicles. And in women, it's the ovaries. And it'll increase that signal so that the testicles will produce more testosterone and the ovaries will produce more estrogen. So conversely, when the hormone levels are high enough, the signal from the brain will shut down and you'll make less of those hormones from the target organ. Now, when we give a person synthetic hormones, or what we call exogenous hormones, meaning we're providing those hormones for your body, the brain senses that the levels are high and doesn't realize that the testicles or the ovaries didn't produce them, that we were giving them to the patients either in injection or cream or pill form. So really what it does is it shuts off that feedback loop. So basically, the organs stop producing those hormones. So it's good in the short term, but in the long term, it can lead to prolonged suppression of natural production of these hormones, necessitating lifelong treatment. So if we can do something that will provide the patient a way to produce more of their own natural hormone without shutting off that feedback loop, that would be the ideal way to treat patients. So for instance, when I evaluate a male patient, I try to use supplements to help the body produce its own natural production of testosterone. So what are those supplements? I like to use Tonkat Ali and Phaedrogia agrestis to increase the natural production of testosterone and free testosterone. So it mimics these signals that come from the pituitary gland, LH and FSH, to make the testicles produce more testosterone and to produce more sperm. I also use ashwagandha to decrease the stress hormone cortisol, and cortisol is an entire episode in and of itself, the stress hormone and how cortisol affects the body. So we'll talk about that in another podcast. But essentially, cortisol from stress destroys testosterone and estrogen. So by decreasing cortisol, I can increase your testosterone levels or your estrogen levels. And this stress hormone cortisol, as I mentioned, is really damaging to your body. So we want to decrease that at all costs. Then I use things like boron to decrease the carrier protein sex hormone bonding globulin, or SHBG. And what this does is SHBG holds on to testosterone and estrogen and keeps it in an inactive form. And it's only the free testosterone and estrogen that is able to do the functions in the body that we want it to do. So if we can decrease SHBG, we can increase the free levels of testosterone and estrogen. So if all goes well, I can increase both free and total testosterone by getting the body to increase its own natural production. And then by improving sleep with lifestyle modification, again, I'll always go back to lifestyle changes, diet, exercise, and adding some other supplements like zinc, magnesium, vitamin D3, K2, which most patients are deficient in vitamin D, even down here in South Florida. I can fully optimize a patient's testosterone production without the use of injections. And I have similar strategies for women as well to increase natural production of estrogen without having to resort to using testosterone, estrogen, and progesterone creams. So there's a lot of different ways that we can do this without actually going to hormone replacement therapy. Now, having said that, if patients are unable to make enough testosterone or estrogen and progesterone to support what they need, then of course we'll supplement that if needed.
Are you seeing a lot of male patients come in they've tried to take testosterone replacing supplements and they've depleted their own supply that you can naturally bring back?
Well, what I'm seeing is a lot of younger patients in their early to mid 30s that are coming in with shockingly low testosterone. And of course, they're looking for testosterone replacement therapy. They want the injection. They come in and, they want the shot. But really, so the first question is, why are we seeing younger men in their 30s having low testosterone? And it's pretty well known in the medical community that over the past 50 years, our testosterone levels have dropped about 50%. And everyone wonders why that's happening. And again, as I mentioned, stress, we're much more stressful environments. So cortisol goes up, cortisol destroys testosterone. So that's the first thing. All the contaminants in our food, right? So we talk about all the hormones that are in our food chain. Those hormones now disrupt the production of natural testosterone in men and estrogen in women. Microplastics. Unfortunately, these microplastics are really causing a lot of systemic inflammation, and they're directly impacting our production of hormones and other endocrine disruptors that you'll hear that term, endocrine disruptors. Simple things like the receipts that you get at a grocery store that have those the special ink that's on them. Well, those are actually, they get into your body, and those are endocrine disruptors and decrease your own production of testosterone and estrogen. So that's really the reason that we're seeing people coming in with shockingly low hormone levels. So those patients, again, we want to see if we can stimulate their own production by decreasing cortisol and doing the other things that I mentioned to get the body to produce its own natural hormones. And we're getting good results with that without having to necessarily resort to using injections of testosterone in men and estrogen, progesterone, and testosterone creams in women. So really, that's the route that I try to take first. And again, if they can't achieve levels that are helpful, then yes, we can give them exogenous hormones if the other means don't work.
That's simply incredible and so interesting that something as simple as a receipt from a grocery store or a CVS can be a culprit of part of that. That's mind-blowing to me. All right, let's move on to stem cells and exosomes. They're a little bit newer to the conversation. What are they, and how do you use them in a regenerative care plan?
So I've been using stem cells and exosomes for quite some time now. But yes, they're coming into, they're all the rage now again. As the prices have come down and the availability of stem cells and exosomes has gone up, it's like any other product. People are hearing more about it and they want more of it. But the problem is, the quality that you're going to get and the types of stem cells and exosomes. Again, it's a nuanced treatment program that really your physicians should be very well versed in. So to explain what these are, stem cells, they are unique, what's called undifferentiated cells, yet these cells can turn into different types of cells because they're undifferentiated at this point. And they act as the body's repair system. They're capable of dividing rapidly to make more stem cells, so they have self-renewal. And they differentiate into other specialized cells like blood, muscle, or brain cells to replace damaged tissues. Thereby, they play crucial roles in healing. So stem cells are vital essentially for replacing lost cells that are damaged from injury, disease, normal wear and tear, just normal aging. Also, stem cells can replace old, damaged, or lost cells in the tissues like skin, bones, and blood. So those are stem cells. Now, exosomes. These are a little different. That's the signal that comes from the stem cell that is doing the magic, so to speak, right? So exosomes, really what they are, they're tiny, non-cellular, nano-sized, or really, really small sacs of stuff, so to speak, that are released by stem cells that act as messengers. They're carrying proteins and RNA and other lipids and other factors into other cells to help facilitate communication. They regulate bodily functions. They trigger healing, regeneration, immune response, making exosomes just vital for bodily processes and therefore promising treatments in regenerative medicine. So these exosomes, again, they're acellular, so they're not a cellular product. They're the tiny vesicles that come from the stem cell, and they're packed with bioactive molecules from their parent cell. Essentially, they are the signal for repair and growth from the parent stem cell to produce more proteins, generate healing, reduce inflammation, and helping with tissue repair. So the key takeaway is that exosomes are crucial information carriers from the stem cell that triggers these powerful healing and regenerative properties that we see that they're able to achieve. So how do I use stem cells and exosomes in my practice? So from an orthopedic standpoint, I will mix PRP or platelet-rich plasma. If you're not familiar with that, we draw the blood, we spin it down, and we basically segment out the platelet-rich plasma, and then we'll mix it with the stem cells and or the exosomes, and I'll inject it directly into an injured joint or muscles or other tissues. And then to really help with the healing, I'll also inject stem cells and or exosomes intravenously into the body, either right before or right after I do the procedure, to help heal that injury from all aspects. I do the same thing with hair regeneration. So what I'll do is I'll actually put that mixture and I'll inject it into patients' scalp to get them to help to regenerate their hair follicles. And for treatment of inflammatory diseases, like I mentioned earlier, some of the neuroinflammatory diseases like Alzheimer's and Parkinson's and other inflammatory issues like rheumatoid arthritis, inflammatory bowel disease, Lyme disease, chronic fatigue, just overall wellness as well, I'll use IV stem cells and exosomes to improve a lot of symptoms that patients have. Generally, I'll do this on a monthly basis, every other month, really just whatever the patient requires. And along with stem cells and exosomes, I also use a combination. We're going to go back to this. You've heard this before: lifestyle modification, diet, exercise, supplements, peptides, and hormone modulation to get the best effect. So again, the stem cells and the exosomes, they have to be supported by a comprehensive program to get the best results. So you don't want to do just the stem cells or the exosomes without changing your lifestyle. If you drink to excess, you smoke, you don't sleep well, you've got a really bad diet, you don't exercise, you're not on the proper supplements, the stem cells and exosomes are going to be a lot less effective, and they tend to be very expensive. So you want to make sure that you're taking care of the basics before you jump to stem cells and exosomes. So an example of what a typical program or a comprehensive program would look like: for orthopedic injuries, I'll do an intra-articular joint injection with PRP, stem cells, and exosomes. I'll follow that with intravenous stem cells and exosomes as well. And then I'll also add some of the healing peptides I talked about earlier: BCP-157, TB500, which is the Wolverine stack. And I'll combine that with physical therapy to get the best outcome. So I don't just do the stem cell in the joint or the stem cell IV. I surround it with an entire program to help make sure that that we get the best result.
You've mentioned about so many different treatments, so many different therapies, but something else that's really, really important to you, Dr. Popkin, is personalization. and making sure that everything you have to offer is personalized and tailored to that specific person. So how do you decide if these regenerative therapies belong in someone's care plan or not, or which ones?
Well, as I said earlier, unfortunately, none of these treatments individually by themselves solve the problem unless they're supported by a really good comprehensive program that takes into account the principles of internal medicine and functional medicine, which again, most of these clinics and online services do not offer. All of my functional medicine programs are rooted in internal medicine and follow the same basic structure or method. So I decide if these regenerative therapies belong in a patient's care plan by, again, starting with lifestyle modification, diet, exercise, and proper supplements, which tend to resolve most of patients' issues. Then, if they still have ongoing symptoms or ongoing issues, after that, I'll incorporate peptide therapy and hormone modulation if needed to further improve their symptoms. Beyond that, if the peptides and the hormone modulation don't fully solve the issues, then I look towards using stem cells and exosomes to improve these treatment-resistant issues they may have. And then finally, I manage prescription medications to round out the patient's care plan. As I said earlier, I try to decrease patients' reliance on prescription medications. An example would be if someone is overweight and they're on multiple medications for diabetes and blood pressure and cholesterol. Well, if you get that patient to lose weight, you can decrease some of the medications that they have to take. So regardless, anything that I add to a patient's care plan is done using very sound internal medicine and functional medicine principles. So I'm not prescribing a supplement or a peptide or a hormone and just allowing that to do the work. I'm creating a treatment program with full support from all the different aspects of the Popkin method, from lifestyle modification all the way up to stem cells and exosomes, if needed. So again, these are not standalone treatments. They must be supported with all the elements that I discussed.
You're talking about this as almost a multi-step process, but we live in the day and age where everyone thinks they're a doctor on TikTok, and Instagram is influencing you to get this supplement and that supplement, right? And it's so easy to say yes to because they're kind of selling you a dream. But it seems like from what you're saying, it's really only a fraction of what makes it successful. What are some of the biggest mistakes that people make when they start self-prescribing or jumping into regenerative therapies or supplements without proper clinical supervision?
Well, the DIY healthcare, do it yourself. That's what I call it. I love this question because I see it all the time. And when patients DIY their healthcare in an attempt to close the gaps in their care plan, they inadvertently create more gaps by randomly and sometimes recklessly adding treatments that don't help or even cause harm. So I'll give you an example. As you mentioned, somebody sees a YouTube video or an ad on social media, either Facebook, LinkedIn, Instagram, or TikTok, for some new fad treatment. And they get sucked into the marketing trap to purchase some supplement or peptide or other treatment. Or they hear about a supplement, they run to Amazon, where unfortunately studies have shown 50 to 60% of the supplements on Amazon are fake or underdosed, or they're contaminated with things like lead or mercury or other substances. Then they use these items, whatever it is, or they go through this care plan, which are unsupported by any medical care plan, which can either help in spite of the odds against it working, or it won't work at all, or even worse, it can cause harm. So I'll give you two examples of what we're talking about here. The first example is when people are enticed by low-price GLP-1 medications for weight loss. So that's the semaglutide, the tirzepatide, and now the retatrutide just came out, and everybody's wanting that. It has just cleared phase 3 trials, so it's not something that we want to jump into just yet. So anyhow, with these medications for weight loss, patients will pay a lower price for the medication, or I'm seeing a lot of these flat fee per month deals that patients are getting. Either way, they don't get the support that's needed for optimal success, because with the semaglutide and the tirzepatide, you need to make sure that you don't lose muscle. And typically what happens in these programs that are unsupported is people will lose equal amounts of muscle as they do fat. So when they come off the program, they now have less muscle available. And it's that muscle that is burning your fat throughout the day. So the last thing you want to do is to lose muscle. And when you lose muscle in these programs, then the likelihood of regaining the weight back after the program or after the treatment is done is pretty high. So that's why I support any of the GLP-1 medications that I use in my program. Again, we're going to go back to lifestyle, diet, exercise, and supplements. So with my program, I make changes to their lifestyle. I help them to sleep better. I put them on a high protein diet, have them do resistance exercises, not just going for walks and doing cardio, but actually lifting weights and doing things that'll help to strengthen the muscle, because that's how muscle grows, by lifting weights. And having them take certain supplements like vitamin D3, K2, and magnesium to boost the effectiveness of the GLP-1 medications. They require proper levels of vitamin D and magnesium and other factors to work well. And then I consider other peptides as well, like AOD 9604 that I mentioned earlier, that will help with weight loss. So sometimes if the patient plateaus on these medications, we'll add other things to help get them jump started again. So I also ensure that the patient is optimized again with their hormone status. So if your estrogen is low in women or testosterone is low in men, they're going to have a harder time losing weight. So again, we want to optimize their hormone status. And I do everything possible to help gain and maintain muscle mass during and after the treatment with the GLP-1 medications to get the best result. So it's important with these medications to follow what's called low dose optimization with these medications, along with lifestyle, to improve the patient's metabolic health and get the best result with the lowest dose possible. And the important thing to remember is that the higher the dose of these medications, the higher the chance of you getting side effects. So we want to keep the dose as low as possible. So by optimizing the other things that I mentioned with lifestyle, diet, and supplements, and peptides, and hormones, you want to make sure you're fully optimized to get the best result at the lowest possible dose. And you don't get these programs with these cheap online medications and these cheap plans that are not program based. So that's important to keep in mind. A second example is getting fake or ineffective supplements on Amazon. And again, as I mentioned, there are studies that show that 50 to 60% of these products are either counterfeit, they're fake, they're underdosed, and they have contaminants in them. So you got to be very, very careful with what you purchase on Amazon. And Amazon's trying to do, they're trying their best to keep these supplements out of their supply chain, but unfortunately, with so many of them out there, it's difficult. So in the case of, let's say, omega-3 fish oils, many of them are contaminated with mercury, or they're flat out rancid from the manufacturing process and the storage and transit. So when you start taking these products that are rancid, it'll actually increase inflammation, which is the opposite of what you were taking it for. So buyer beware. Be very careful what you're seeing out there on social media, because it's the marketing and the AI and all the different purchasing traps that you get sucked into can really take you down the wrong path.
Dr. Popkin, you've mentioned a few risks already, but are there other risks that people should be aware of with off-market peptides and hormone replacement therapies and stem cells and exosomes, things that are perhaps maybe even higher risk than just an omega-3 fish oil pill, right, that aren't physician managed?
Yeah, this is the classic, buyer beware. As I mentioned, the issue with some of the supplements on Amazon, or the contaminants that we see. But again, when we're looking at other things like peptides, peptides from overseas, they may not even be peptides, or even worse, they may not be sterile. They may have dangerous contaminants in them. So you have to be careful with that. As far as the stem cells and exosomes, these can have cell counts and exosome counts that are far less than what you're paying for, or even worse, they can have infectious, viral, and bacterial contaminants in them. So you want to be careful with that. Then there's the risk with, as I mentioned earlier, with long-term hormone replacement therapy. Again, when we're providing hormones to a patient, we can shut down their own natural production. So we have to be careful not causing permanent suppression of their own hormone production. And then there's the risk of the expense itself, right? You're paying for these things. So if you're purchasing something that's ineffective because it was poorly chosen, or it was ineffective because it wasn't of good quality, now you just wasted your money. So that's a risk as well. And there's also the risk of interfering with a patient's underlying medical issues. And this is where I keep going back to what I do is a blend of internal medicine and functional medicine. Because with the functional medicine, if you don't understand the good, solid internal medicine principles, then you can actually hurt somebody. And for example, giving patients too much omega-3 fish oils doesn't seem like it would be that much of a problem, but studies have shown that atrial fibrillation can be triggered by too high of a level of omega-3 fish oils in some patients. Atrial fibrillation is not something you want to trigger. It can cause strokes and other issues. So we want to stay away from that. Also causing kidney issues from dehydration by using these GLP-1 medications. So what we're seeing is patients that are going on semaglutide or tirzepatide, not only are they eating less, but they're drinking less. So if they're drinking less, they have a risk of dehydration, and that can cause kidney issues. So again, these treatments are not without side effects if you're not careful, which is why it's important to use good quality products and to work with a physician that knows what they're doing, so that they are following good, sound internal medicine along with functional medicine principles. So again, to avoid these issues, make sure whatever treatment you choose, make sure it's part of a comprehensive care plan, and it takes into account the underlying medical issues that you may have. And if possible, get your primary care physician involved to help coordinate the care.
Yeah, people think they're trying to save money in the short term, but really can be costing themselves more money and their health in the long term by making some of these mistakes. How do you personally source and vet the regenerative therapies that you offer? And how should patients evaluate their provider if they're doing it safely?
Well, first and foremost, try to only use trusted sources. So how does that relate to supplements? Well, to verify supplement safety, look for third-party certifications like USP, NSF, and Consumer Lab on the label. That'll indicate testing for ingredients and contaminants. You can research the brand and product on reliable sites like the National Institute of Health's Office of Dietary Supplements. You want to avoid supplements that have vague, what's called proprietary blends in the label, or have exaggerated claims. You also want to make sure they have clear labels and tamper-resistant seals. And going back to the proprietary blends, when you see these on a label, something has a proprietary blend in it, that means that the manufacturer doesn't have to disclose what these blends are actually made of. So that's not something you want to be taking. Now, when you're verifying peptide safety, and this is super important because we're seeing peptides everywhere on social media, you want to make sure that you're choosing a reputable GMP certified supplier. And you want to demand third-party certificates of analysis for purity and product identity. And the ones that don't have this, don't get them. Don't spend your money on it, and certainly don't inject them into your body. Ideally, using FDA approved or pharmacy compounded products under medical supervision is the best thing. So again, going and purchasing these peptides online without proper medical supervision is dangerous and reckless, in my opinion. You always want to consult the doctor and avoid using these unregulated gray market peptides. Use a physician that knows how to use peptides. I mean, it's really the bottom line. And you want to also ensure that the certificate of analysis confirms high ingredient purity, at least 98% purity, and correct composition for safe use. So in particular, the peptides that I use, the certificate of analysis shows that it's got 98, 99%, even 100% of what it's supposed to have in there. And you would think that that's a standard, and it really isn't. A lot of these peptides, some of them have 0 peptides in them. So the certificate of analysis and the third-party testing is real important. Now, to verify hormone replacement therapy safety, again, it's super important to choose a knowledgeable physician that will personalize your care. You want to focus on FDA-approved hormones from reputable pharmacies. You want to ensure this is real important, you want to ensure regular monitoring of blood tests and symptom checks to make sure that what you're taking is actually correcting the issue, both from a symptom standpoint and a laboratory standpoint. And you want to discuss the risks and benefits based on your own health history. Remember, safety comes from individualized treatment. And I want to go back to this a little bit with regard to hormone replacement therapy. The regular lab monitoring should include not just a total testosterone or a total estrogen. And I see this all the time. Patients will come in and they're with other providers and they have blood work and they say, oh, my doctor, they tested for everything. And then I look and I see they only have a free and total testosterone, or they have an estrogen level, but they don't have a lot of the other supporting labs that's needed. So it's not just total testosterone. You want to look at free testosterone. You want to look at estradiol. You want to look at sex hormone binding globulin. Again, that's the protein that holds on to your hormones and makes them inactive. It's only the free version of your hormones that's active. So you want to look at sex hormone binding globulin, or SHBG. PSA in men, prostate specific antigen in men who are on testosterone therapy. You want to look at hemoglobin and hematocrit, because the testosterone can raise the red blood cells. So if the red blood cells get too high, there's a risk of heart attack and stroke from that. And then you want to look at some other supportive neurotransmitter hormones like DHEA, pregnenolone. That's important to look at. LH and FSH, that's the signal coming from the pituitary gland I mentioned earlier. And in some cases, dihydrotestosterone, if we're dealing with patients who are genetically inclined to having a hair loss. You want to make sure that you're looking at DHT levels and you're controlling that. So ideally, these labs should be checked every 3 months to check for proper levels, look for liver and kidney problems, check PSA spikes that might indicate a prostate issue, look at the red blood cells, the hemoglobin and hematocrit, as I mentioned, to make sure the blood doesn't get too thick and sluggish from increased red blood cells, which could lead to a heart attack or stroke. And lastly, don't get your hormones from some dude at the gym or your personal trainer, right? I've seen this. I can't tell you how many times I see this happening. You have no idea where the products are coming from. You have no idea if they're safe. And you think that this doesn't happen very often, but I can't tell you how often I see this happening, that people, they tell me they get their products, at the gym. Don't do that.
Do it the right way the first time.
Yeah, you definitely want to do it right the first time. And I did leave out, we talked about stem cells and exosome products. You want to verify their safety as well. So what you should ask for FDA documentation or an IND number, an investigational new drug number that shows that they're in an approved clinical trial, if they are. You want to ensure that the provider, explains the risks, uses proper consent forms. You want to confirm that the products are tested for identity. What type of cells are they? What type of exosomes are they? How pure they are. You want to look at potency. With providers offering details on the source and the processing and the potential adverse effects. You want to also understand that most of these treatments lack FDA approval for specific conditions. So you really want to make sure you use a provider that knows what they're doing, and do your vetting process on the clinic and provider. As I just mentioned, you want to demand transparency. A trustworthy clinic will provide this documentation. They'll explain the risks and benefits. They'll have institutional review board oversight of any clinical trials if one is being conducted. So really, buyer beware, do your due diligence, and don't chase the cheap, inexpensive, marketed product on social media.
Wow. Well, you have said before that all of these therapies are tools. They're not magic bullets, right? It really is a process and a method, the Popkin method, and talking about how they fit in alongside to, lifestyle modification, diet, exercise, getting proper sleep, which is easier said than done these days, but so important for our health. How do all of these things fit in together?
So I have properly brainwashed you. You understand lifestyle modification, diet, exercise, and supplements will fix a multitude of problems. Then you can go on to things like peptides and hormone modulation and stem cells and exosomes. So by correcting a lot of these lifestyle issues, you got to correct those things first before you move on to anything else. So again, this is the basis for what I do. It's how I've practiced medicine for 25 plus years. And I've said throughout the podcast, none of these treatments individually will solve the problem unless they're supported by a comprehensive program. And you need good sound principles in internal medicine, functional medicine, And you just don't get this with most of these clinics and online services. They just don't offer it. So again, the common theme of the podcast is that all of my functional medicine programs are rooted in internal medicine. They follow the same basic structure of the Popkin method. Starts with lifestyle modification, diet, exercise, and proper supplements, which fixes a lot of the issues. Correcting the bad lifestyle habits like smoking, excessive alcohol consumption, improving sleep quality, removing toxins, hormone disrupting chemicals, microplastics, managing stress. They're very important lifestyle modification elements that I like to correct. Now, incorporating an anti-inflammatory diet that's high in protein, low in complex carbs. When I say complex carbs, I mean bread, rice, potato, pasta, cereals, all the things that are pretty much staples in the American diet. You want to get rid of those. Simple sugars, get rid of those, especially high fructose corn syrup. And you want to add in healthy fats, so things like olive oil, avocado. This is going to help with weight loss, energy levels, brain fog, hormone production. And then we move into things like exercise. So resistance exercise that will increase your lean muscle and decrease fat. It'll go a long way to add to your health and lifespan. And I try to explain to people that muscle is your lifelong currency, and muscle is your reservoir to burn calories, to soak up glucose, to eliminate fat, to keep you from falling. So the more muscle that you gain and maintain throughout your life, the healthier that you're going to be. Then we talk about the supplements. I put all of my patients on the core 5 supplements, including creatine, vitamin D3, K2, magnesium, pre and probiotics, and omega-3 fish oils. And if you want more information on the use of these supplements, go to thepopkinmethod.com and listen to episode 3 in my podcast series on supplements. I'll tell you all about it. And as I mentioned, after lifestyle modification, diet, exercise, and supplements, the majority of the symptoms are greatly reduced. After that, we talk about peptide therapy, hormone modulation to further improve the patient's health and wellness. So some of the examples I talked about, the GLP-1 medications, semaglutide and tirzepatide for weight loss, the growth hormone stimulating peptides, sermorelin, ipamorelin, tesamorelin, CJC1295, BPC157, TB500 for tissue repair and wound healing, the copper peptides, GHK copper for skin and hair issues, AOD 9604 for fat loss, MOTS-C for energy, and then the ones we talked about, CMAX for brain fog, C-LANC for anxiety, and BDNF for Alzheimer's and Parkinson's and other neuroinflammatory diseases. These are things that can have tremendous benefits for patients if it's appropriate to treat with those. And then beyond that, again, we talked about stem cells and exosomes and management of prescription medications. So that's pretty much the method that I use, the method that I follow. And it's something that I think, as long as it's incorporated into a good program, this is something that's going to be quite helpful for patients.
Sounds like the bottom line is if I'm a car and I'm a broken down car, we can't just slap a coat of paint on it and think it's going to run the same. We need to work on the inside first and not just go straight to these fancy hot button word solutions here. For someone listening who's curious but still cautious, what's the first step that they can take to explore these options more responsibly?
Well, in this landscape of AI and deceptive marketing, I think curious but cautious is a really good way to approach these regenerative therapies. Again, the first step is to do your own research and do your own due diligence. Ask the doctor questions, get third-party testing of your supplements and peptides. Find a trusted provider that has experience in using these products in a regenerative program that includes all the internal medicine and functional medicine components. The second step would be for you to schedule an online or an in-person visit with me to discuss your personal situation, your personal goals. I can then put together a plan that's right for you. You can feel free to message me or schedule an appointment on my podcast website. Go to www.thepopkinmethod.com or email me at mcpopkinmd@yahoo.com and put podcast in the subject line and I'll get back to you. You can also follow me on YouTube or any of my social media sites, including Facebook, LinkedIn, or Instagram. And I look forward to talking with you soon.
Awesome. Thanks so much, Dr. Popkin. If we don't have our health, we don't have much. So we need to make sure we're taking care of it the right way and making sure we're going to the right sources to take care of it the right way. There's a lot of noise out there and too many promises without enough guidance. But when our modern tools like peptides, hormones, stem cells, and exosomes are used strategically in a comprehensive care plan by a doctor who knows how to blend safety, science, and personalization, that's where the real healing can begin. And if you're ready to explore these therapies the right way, visit thepopkinmethod.com to learn more and schedule your online discovery call or an in-person visit with Dr. Popkin today. This is the Popkin Method, and we'll see you next time.